I used to believe that statins should be in the water because I felt that they would benefit just about everybody. But through my research, I have found that statins are not the golden pills that people have brought them up to be. Today, I'm going to give you updated information so you can make an informed decision on whether or not to start statin therapy. At the end, I'm going to give you 3 questions you should ask your doctor prior to starting statin therapy. Hi, Dr. Knapp here again, here to bring you medical information so you can take control of your health and make the most out of your doctor's visits. The decision to start a statin is made on a case-by-case basis between you and your doctor. Your doctor should consider current lipid levels, your risk for heart attack and stroke, as well as your other medical issues to determine if statin therapy is right for you. Before I talk about risks, I want to talk about a couple groups of patients that may benefit from a statin. First group is the high-risk group. These are people who the available evidence clearly support being on a statin. They are patients with a prior history of heart attack or stroke, a high-risk medical condition such as peripheral artery disease or diabetes, or excessively high cholesterol levels. These patients should be on a statin to lower their excessively high risk. For the next group of people, the decision to start a statin is less clear. These are people who are asymptomatic and do not have a history of stroke or heart attack, and also do not have a high-risk medical condition. Physicians typically utilize a risk calculator to determine if a patient may benefit from a statin. These typically take into account your cholesterol levels, your age, comorbidities like your blood pressure, as well as whether or not you smoke, and will provide you with a 10-year risk of developing a heart attack or stroke. Now keep in mind this is a general risk based off a population of people and is not specific to you. Physicians should also consider other factors such as your overall health, whether or not you exercise, your diet, and among other things to determine if a statin would be appropriate for you. One issue with statin therapy is the magnitude of benefits that they may provide. It is common practice for commercials, even some physicians, to describe the benefits of a medication by something called the relative risk reduction. This is the percent difference between 2 outcomes in a study, and usually makes results sound more impressive. For instance, this statin lowers your risk of heart attack by 28%. In reality, it is important that medications be discussed in a context of something called the absolute risk reduction, which is the difference between 2 outcomes in a study. When looked in this way, the benefits of statins are far more modest. A study published in the Journal of American Medical Association in 2022 showed that the absolute risk reduction of statin therapy for heart attack is only 1.3%. Put another way, 77 patients would need to take a statin for a certain amount of time in order to develop a benefit. In other words, to prevent 1 heart attack. Keep in mind that in 2021, over 695,000 people died of cardiovascular disease, and the higher your risk, the higher the potential benefit of statin therapy. Now, risk calculators are not crystal balls and only are able to evaluate your risk with so much precision. Some people at high risk may never have a heart attack or stroke, while those at low risk may still have an event. There are other more objective measures of someone's risk that should be considered. One is a coronary calcium scan, which is a CT scan of the heart, which looks at the plaque burden by means of measuring the amount of calcium buildup in the arteries. This can provide a much more accurate picture of your risk for heart attack. For instance, in a paper published by Mitchell and colleagues, it was found that in those patients with a coronary calcium score greater than 100, statin therapy was associated with greater than 8% absolute risk reduction of heart attack. This brings the number needed to treat to 12. This data, when combined with your other risk factors, is a powerful tool for risk assessment. I recommend considering this test if your risk is not clear-cut or if you desire a more objective measure of your risk. There are 2 labs available, ApoB and Lp(a), which can further assess risk. ApoB is a direct measure of the number of cholesterol particles in your blood. If elevated, portends a higher risk. Ideally, it's less than 100. Lp(a) is genetically determined and provides you with a genetic evaluation of your risk for heart attack, as well as other things such as aortic stenosis. Both of these labs can contribute to your overall risk calculation and are considered risk enhancers. Now, statins, like any medication or supplement, is not without risk. Studies have, for the most part, shown low risk of side effects relative to placebo. However, there are certain side effects that are more common in clinical practice. For instance, muscle pain is by far the most common side effect seen with statin therapy. In a paper published by Parker and colleagues, it was found that 10% of patients will develop muscle pain from statin therapy. It is important to consider, however, that all the patients in this study were on high-dose statin therapy, and like any medication, the higher the dose, the higher the risk of side effects. Other important side effects include elevation in liver enzymes in 1 to 3% of patients, although liver damage is incredibly rare. Kidney damage can also occur, but again, very rare, and actually many studies show a decrease in kidney decline. In other words, they are kidney protective. There are multiple medications and foods that can interact with statins. Examples include amiodarone and grapefruit juice. So your doctor should evaluate your other medications and ask about certain dietary patterns to determine if there are any interactions that can be present. Some studies have showed an increased risk of developing type 2 diabetes or worsening diabetes control. I believe, however, in these patients, they already had high risk for developing diabetes, or they already had suboptimal control. In my practice, I haven't seen any cases of worsening diabetes when starting statin therapy. The evidence for mild memory problems is weak in my opinion, and in fact, multiple studies have shown a decrease in the rates of some forms of dementia. Regardless of the potential side effects, if you develop symptoms that you're concerned are because of the statin, you should talk to your doctor about it. How do statins work and why do doctors prescribe them? Well, they work by inhibiting an enzyme in your liver that produces cholesterol. This in turn reduces the number. There are other effects such as a decrease in the atherosclerotic plaque size and an increase in the blood vessel lumen diameter as seen with long-term statin therapy. There are also anti-inflammatory effects as seen by reductions in an inflammatory marker called CRP. Interestingly, in patients with rheumatoid arthritis, statin therapy has been shown to reduce inflammatory markers and reduce symptoms of joint pain. I just want to take a moment to ask that you hit that like button, leave a comment, and by all means, if you know someone that might benefit from this information, please share with them. So we prescribe statins because we believe that the benefits outweigh the risks. They are not magic, however, and only reduce your risk so much. It is important that your doctor consider you as a whole person as well as your risk to determine if statin therapy is right for you. I would argue that having a healthy diet, not smoking, controlling your blood pressure, and getting at least some regular exercise will reduce your risk a significant amount and should be considered whether or not you start statin therapy. If you are interested in reducing your risk of heart attack or stroke by means of improved blood pressure control, see my video on combination blood pressure medication. Now here are the 3 questions that I think you should ask your doctor prior to starting statin therapy. First, what is my risk for heart attack or stroke and how much will a statin reduce that risk? 2, how long should I be on a statin? And 3, what other things can I do to reduce my risk? Well, I hope you found this information useful. As always, take care of yourself and make the most out of your day.